I'm Rob.
And I'm Sniffles.
And this is Redneck Randomness. Today, we're going to talk about a couple of different things. PTSD, as far as veterans go, which I am proud to say I am one.
To help you families out there to understand, because mental disease is one of those things that people just
Can push away.
push away, and they seem to think that people can control it without therapy.
And we're going to talk about bone and muscle degeneration as far as military veterans go as well. I think we're going to start off with the PTSD. I have PTSD. It's manageable as long as I take my pills on a regular basis. I find that talking about it only makes it come back to me more, and then it makes me even more mad.
Now, post-traumatic stress disorder is a dysfunction of the brain, either caused by damage or by severe trauma, which is an enormous realm of what trauma is. I mean, it could be seeing your best friend die. It could see your cat die. You could see, a pink bunny die, and because you were so involved in it, this is serious. That you're so involved and love this thing so much that it just causes you all kinds of mixed feelings and emotions and everything else, and you may react.
Or it could be that you're overseas 3 times, and on all 3 tours you saw somebody die. I mean, that's what mine is from. First tour I saw 6, 7 of my buddies die right in front of my eyes. Second tour I saw 1 guy die, and the third tour I saw about 3 guys die. So I mean, mine is generalized in combat. And there are days where I go without a flashback, and then there's days where it's almost nothing but flashbacks, and the agitation comes from nowhere. It could be something simple as somebody asking me a question, and me not knowing really right offhand knowing the answer, and then I get mad and I want to go after them and punch them. And I mean, it's gotten to the point where people walk by and I hear them saying something stupid, and I just want to rush out and beat the crap out of them.
Well, you can tell when somebody with PTSD is experiencing flashbacks because of the total gloss in their eyes. Okay, they are not there. They are reliving what happened to them.
They could actually be talking to you,
and not be talking to you.
They're once you see their eyes go to somewhere you don't want them to go, or where you think that they shouldn't be, stop talking, get away from the person, because I mean that could seriously agitate. You bringing them back to reality can seriously agitate the person, and then the next thing you know, they're on top of you. Not only that, but loud noises. Loud noises tend to irritate the crap out of me. Like when my kids do the high screechy thing.
Oh yeah.
I can't help it. I yell at them. I say, "Shut up!" But not in nice terms like that. That's all part of the PTSD. I'm not putting it on because I have control over myself, but I have no control over what my brain wants to do.
Right. And see, that's why we're bringing this to light. Is there is a stigma on mental disease or disorders that people seem to think that that they're either faking it or that they can control it themselves by modifying their behavior. This is not true whatsoever. Not in any way, shape, or form.
Now there are ways to not combat. You can't really combat the brain. there's tests out there. I had to take one, and comes back that I definitely have PTSD. And I actually got the newest modified version of the test that the actual VA does, and it came out a little bit higher than my first test. And why they do that is because there's people that come back from Kuwait, not seeing any action. They were in Kuwait their whole time, and they somehow have PTSD. And now that they've got that new test out there, it's easier for them to say, if the person's under 50%, here's the meds, go away.
Right. And let's go over some of the symptoms of PTSD, because sometimes, like Rob over here, you'll just be talking to him and he'll hear a loud noise, and all of a sudden that gloss comes over his eyes, and if you're not careful, you're going to end up with a combat veteran wringing your neck, pretty much, if not worse. So, the symptoms are intrusive memories, basically reliving those unwanted memories of what has happened.
Yeah. Oh, yeah.
Reliving the symptoms, the dreams. So they'll wake up in a cold sweat.
There was one time I was sleeping, and my wife nudged me to wake me up, and when I woke up because I guess my eyes were open, I was on top of her, holding her down like this.
That was the other part that I was going to mention, is that it's the flashback.
It's a vivid dream.
And severe emotional distress or physical reactions to something that reminds them of the event. So, say one of your vets come back and you go to a fireworks show. There's a very, very good chance that they think that that's a bomb, or that somebody's firing at them.
I can't even do
he can't do fireworks.
The last time I went to a fireworks display, I was actually on the floorboard of my car looking for my weapon. So,
yeah.
And there was also one time I got back and I was driving, and April was in the car, and I think she was the only one. And I'm driving and I see this white Toyota. You know how many bolos were in Iraq for a white Toyota? So I said, "What's the bolo report?" And she said, "What?" I said, "What's the bolo report? Who do we have gunning?" It's instinct. I mean,
right.
It all comes back to, I've seen combat, and when that kind of stuff happens, I'm just like, and it takes a lot out of the person. They're not fully.
Exactly, they're not there.
They're not fully there.
Avoidance. So basically, your depression, which is not fake, people. It's not fake. It's a real disorder. When they don't want to go into that memory, they will avoid everybody and everything and just hide. And
there's been times where I've gone into that, and you've tried to get me to do something, and you call me or you text me, and I don't pick up, or I don't text you back because right. It's the mental of it, and it just.
And I used to push him on that. I don't do it anymore because I understand what it is now. Negative changes in thinking and mood. This goes along with the whole depression thing.
It's also random. Like I could wake up in a damn good mood, and nobody has to say anything to me. By about noon, I'm in the mood that I just want to hurt somebody because I'm having the flashbacks, and it's a vicious cycle, and a lot of people don't realize what kind of a cycle it really is.
And then you got your it totally affects your memory.
Yeah. Yes, it does.
Yep. So if your vet is coming back and they've got they're thinking about suicide, or they shouldn't be here because they lost a friend over there. Rob has done that.
Do whatever it takes
to get them to see a doctor.
No,
take them to the VA.
Not necessarily, because they could have already seen one. But if they're still thinking about suicide, talk to them. You know, just try to get them to recount what's bothering them to you, and do it in the strict confidence that you're not going to say anything to anybody else.
Correct, but that may just be aware that may also throw them into a.
And if you see them getting agitated, just stop your questions.
Yeah, stop your questions.
Back off. Just sit down somewhere else outside. You know, like if you're this close to the person you're asking questions, sit on the other side of the room, right across from them, so they can still see you, but you're not talking. Keep your hands where they can see them, because, well, if you put them somewhere they can't see them, the combat vet's going to actually think you got something and go out.
Right. And see, what I was talking about is if they've already seen a therapist at the VA or whatever, great. They're on their road. The ones that think they're fine and come back, and all of a sudden they go ballistic for no reason.
See,
those are the people those are the vets that need to see a doctor.
And I can say this from experience. After my first tour, when I got back, I didn't really believe that I was in the head with PTSD, but after I asked for the Bolo report, who the gunner is, waking up and pinning April down, and then actually waking up. And also
our camping trip.
My oldest, with the camping trip, my oldest said something offhanded when he was like 12, and I pinned him against the couch. I mean, I had no control over what I was doing.
You weren't even there.
My brain was just misfiring the whole time.
You weren't even there.
The camping trip, I had an MP5. Somebody said something, and I went ballistic.
Yeah, and you basically grabbed trashed the campsite, grabbed the MP5, and
trashed that too.
Yep, and was looking for the enemy.
Yep. Yeah.
And I had to chase his butt down.
And now that we're done, let's stop talking about PTSD. Yep. Let's go to the bone and muscle degeneration. Now, a lot of people think that it's hereditary, but for your combat veterans, 90% of it is non-hereditary. It's actually a side effect of a drug that we were injected with.
The anthrax.
Our first time, a second time, and then they finally got rid of it in 2008 after they really saw a significant increase of bone degen and muscle degen when troops were actually, the walls of the heart were getting so paper thin that they would just bleed out.
Right.
And I'm going through that with my right forearm is muscle degeneration. It doesn't work the way it should. I mean, there's definitely muscle in that, and that's as far as I can go with this hand.
Right.
So, I mean, 90% of it is for combat veterans is the anthrax shot. Mm-hmm. I got through all 6 shots into my 1-year booster, and they actually gave me 9 1-year boosters in 2 months. And all of them were from a lot that was unknown, and a manufacturer that was unknown, and ingredients were unknown. But they were still injecting the troops.
Wow.
And there's nothing, you can say, oh, no, I don't want that, but then they're going to get back to your commander, and you're going to get reduced in rank, and it's better just, especially in the military, to go along, to get along. And I'm not really necessarily one of those kind of guys that like that shit.
So, if your veteran comes back and, they try to get work, but they're going off the deep end and trying to attack people, or they just can't do the job. Send
them to the VA. The VA actually has a vocational rehabilitation program for PTSD
And
and degeneration stuff. Plus, they also have, if your loved one or you're a combat veteran, has come back and had lost a leg or an arm, and they're just having a tough time transitioning, the VA can help with that.
that is correct. That's what they're there for.
So we just thought we'd bring these things to light, so that when you hear about it, you're not like, oh, that BS. It's not. Coming from a combat vet, like I said, I've had like 17 shots of anthrax, and I got PTSD. So it's.
And since we're running out of battery on everything right about now, we want to thank you for listening, for
Joining us
watching.
today. Go ahead and push the like button, leave a comment.
Subscribe. Let us know if you like this series.
Follow
Because
us.
we love it. We love talking about this stuff.
Follow us on Facebook, Twitter, and Google+.
And if you guys have anything that is not in the public limelight that you want to discuss and bring awareness to,
Shoot us an email.
shoot us an email. Get a hold of us on Twitter, Google+, Facebook, or send us your video explaining what you want to do to redneckrandomness2014@gmail.com. All the stuff is in the description.
Stay classy.
Stay cheesy.
Stay random.
And thank you, vets.